Hi, I am Dr. Niharika Jain Gupta and I am an endodontist from Central India, Madhya Pradesh. I welcome you all to this first episode of Masterclass in Endodontics. Friends, today's session will be delivered by an eminent speaker, Dr. Vijetha Badami ma'am, and she is a Vice Principal and Head of the Department of Conservative Dentistry and Endodontics at MNR Dental College, Sangareddy, Hyderabad. The session will be moderated by Dr. Sagar Shah, who is one of the finest clinician of the country. And about the series, it is proudly presented by a company known as AshKam, which is a clinician-led initiative committed to providing high quality, affordable, and reliable dental materials and medical devices for practitioners across the globe. So without further delay, I now hand over the session to our respected moderator, Dr. Sagar Shah. Dr. Sagar, are you there, please?
Yeah,
So the screen is all yours, Dr. Sagar.
Hi everyone. Good morning. Good morning, ma'am. Requesting everyone to please mute themselves before we start the session. As ma'am mentioned, it's a pleasure to have Dr. Vijetha ma'am with us. Please requesting everyone to please mute themselves. Vijetha ma'am, can we start the screen share of your presentation? So, again, a very good morning to one and all. Today, we are here for the first lecture series organized by AshKam on Bend It Like Beckham Curved Canal Edition. Niharika ma'am already has introduced Vijetha ma'am, who is one of the finest clinicians and academicians in the country. And without further delay, let me welcome ma'am to start today's session for the team.
So, very good morning to all of you. Hope I'm audible.
You're audible, ma'am.
Yes. Is my screen visible?
Yes, the screen is visible.
Yes. Very good morning once again. It gives me great pleasure to welcome you all to my presentation, Bend It Like Beckham, the Curved Canal Edition. At the outset, I would like to thank Dr. Niharika Jain for giving me this opportunity to share my knowledge and Dr. Sagar for moderating the session. Cleaning and shaping of the root canal system is one of the most important steps for successful endodontics. So, of all the phases of anatomic study in the human system, one of the most complex is the pulp cavity morphology. The total volume of the pulp cavity of all the 32 teeth put together is just about 0.32 cc's. But this small tissue can cause a great deal of agony both to the patient as well as the dentist because of its complex nature. Nature seldom draws a straight line, and mostly the canals are curved. As you can see from these radiographs, the canals are curved in multiple directions. One thing we need to understand or remember here is these radiographs are two-dimensional images of three-dimensional objects. So apart from the curvature that we see here in the mesiodistal plane, there is a curvature also, or there can be a curvature in the buccolingual direction. So CBCT is a very useful tool before we start any complex case. According to a study by Sheffer et al., 84% of root canals are curved at least in one direction, and 17.5% of these curved canals exhibit a secondary curvature. So whenever a canal has two curvatures, we refer to it as an S-shaped canal. Before you start any case, you need to remember two things. Always expect the unexpected, and no two root canal systems are the same. It is said that a problem well stated is a problem half solved. So defining the problem solves half of the thing for us. So here, defining the curvature helps us in making proper strategies. Regarding the curvature, there are three things that we need to understand: the location of the curvature, angle of the curvature, and the radius of the curvature. So when we divide the canal into three parts, the apical third, the middle third, and the coronal third. Excuse me.
Please go on, ma'am. It was someone who had unmuted himself.
So when we divide the canal into three thirds, the apical, middle, and the coronal thirds, the apical curves are the easiest to manage, whereas the coronal third curves are the most difficult to manage. Regarding the angle of curvature, now there are many measurements to determine the angle of curvature given by various authors, but we can follow one given by Snyder. So the Snyder's angle is measured by drawing two lines, one along the long axis of the tooth and the other from the apical area to the point of curvature, and this angle is referred to as the angle of curvature. So according to this classification, if the angle is 5 degrees or less, it can be classified as a straight canal, and it is the easiest to manage. 10 to 20 degrees are moderate curvatures, and a curvature greater than 25 degree is a severely curved canal or a dilacerated canal. Coming to the third point regarding the curvature is its radius. So here you can see that these two teeth have the same angle of curvature, but the radius is different. When we complete the circle and measure the radius, here we can see that the radius is much larger than this radius. So though these two teeth have the same angle of curvature, because of this tooth having a much smaller radius, it becomes a much difficult case compared to this one. Now, these curvatures can cause a host of problems like ledge formation, perforation, apical transportation, zip formations, and file separations. Now, whenever we are using a stainless steel file in the canal, if you are using even a number 15 file, it can be considered a stiff file. So because of its stiffness and its cutting tip, instead of going into the canal, it will create a path in its own direction, and this step created on the outer wall of the dentin is referred to as a ledge. Now, if we continue filing in the same way, we can either end up in an apical transportation if we are doing it in the apical region, where we are tearing the apical foramen and creating an oval shaped tear, which is going to be very difficult to clean and obturate, because the narrowest portion here is going to be a little above the apical foramen at the elbow region. And if you are doing this sort of filing somewhere in the middle or the coronal thirds, we will end up in a perforation. Apart from this, the most important thing which the clinician dreads is the file separation. So now the question is, how do we solve these problems? So to reach any goal, we can divide the journey into steps. So one step at a time is all it takes you to get to the solution. So I have divided the management of curved canals into 8 different steps, starting from a straight line axis to proper irrigation, lubrication, and recapitulation. So let us look at these different steps. So the first step being the straight line axis. What do we mean by a straight line axis? So whenever we are placing any file in the canal, it should not be having any interferences in the coronal portion of the axis cavity. As we can note here, this file is being hindered by the roof of the pulp chamber, and this causes stresses on the file and result in. So this coronal interference can be removed by modifying or refining the axis cavity. This can be done by a safe tip burr which does not have diamonds at the top. So it is balled here, and this can be safely placed on the floor of the axis cavity, and using this we can refine the axis cavity to reflect the internal anatomy of the pulp chamber to the external. And as you can see here, we achieve a straight line axis with no interference on the file in the coronal portion. The trend is towards conservative endodontics, where we want to preserve the strength of the tooth and remove minimum tooth structure as possible so that the fracture resistance is maintained. So this area 4 mm above the CEJ and below the CEJ is referred to as the pericervical dentin, and this plays a crucial role in the fracture resistance of the tooth. So we can refine the coronal axis cavity with the help of ultrasonics, which do not remove excess tooth structure, and they can provide straight line axis. Another useful tool for this is the endo guide burrs, which are conical shaped burrs, and they have a self-centering ability to achieve straight line axis. They also remove minimal amount of tooth structure and conserve the healthy pericervical dentin. So the next step for achieving success in a curved canal is coronal pre-enlargement. So this is basically enlarging the coronal third of the canal before we put our instruments in the middle and the apical thirds. So this can be achieved with the help of Gates-Glidden drills or the orifice shapers. So in any of our endodontic instrument set, the first instrument will be having a greater taper and it will be shorter in length. So this is the orifice opener, and this can be used to do the coronal pre-enlargement. Now doing the coronal pre-enlargement gives us lot of benefits. The first thing is it gives the clinician a better tactile sense when we are negotiating the middle and the apical thirds of the canal, because the file is not stressed in the coronal portion of the canal. At the same time, you are removing a greater bulk of pulp tissue, bacteria, their endotoxins before we are negotiating the apical and the middle thirds. So this reduces the extrusion of debris into the apical third and through the apical foramina into the periapical tissues. So it increases the patient comfort by reducing the post-operative pain. Also, it helps in holding a greater volume of irrigant in the canal and helps in achieving better disinfection. So the third step would be the preparation of a glide path. The glide path has been defined by John D. West as the secret to rotary safety. Now, what is a glide path? Glide path is nothing but the path that we create from the orifice to the apical foramen. It can be a smooth radicular tunnel from the canal orifice to the apical foramen. So what is the minimum size for the glide path? It should be at least a super loose number 10 endodontic file. This reduces the stresses on the rotary nickel titanium instruments, help in preventing fracture of these instruments. So a reamer is a better instrument than a K-file to achieve a glide path because the reamer has greater flexibility. Also, it has a dead soft quality. So when we are creating a glide path with a reamer, it also helps us in recording the shape of the canal three-dimensionally, and this will help you in further preparation of the canal. So sometimes the file will not initially reach the apical foramen. So John D. West said there could be 4 reasons why this minor apical diameter is a long way off. So in the first case, we see that there is accumulation of debris and tissue at the apical foramen. So in this case, what we can do is we can irrigate the canal, like put the irrigant into the canal and use a small file like a number 8 or a 10 file to gently peck at this apical region. So this will loosen the debris and help us in negotiating the canal file up to the apical foramen. The second reason that your file may not be reaching up to the apical foramen region is the angle of incidence and is different from the angle of axis. So here the file basically has restrictions in its coronal third. So we need to look at where the file is getting restricted, remove these coronal restrictions, and then the file will reach into the apical foramen region. Is it getting shared?
The screen share has stopped now.
Yeah, is my screen visible now?
No, ma'am.
Okay. Is it
The screen
visible
is
now?
visible.
Yes, ma'am.
Yes.
Now visible.
So, the third reason that the file might not reach the apical area is the diameter of the tip. Then we need to just change to a smaller size file and we will be able to negotiate the canal. The other reason is the diameter of the shaft of the file. See, we need to remember here that the file is not larger at the coronal area and narrow at the apical region in all the cases. There might be restrictions in the middle third sometimes. So this causes interference with the shaft, and enlarging the coronal and middle thirds or shifting to a smaller size instrument will help us in negotiating the apical foramen. So the techniques of glide path preparation. Initially, we need to use the hand files, which are the K files and the reamers. As we discussed earlier, reamers are much better instruments because of their flexibility. Here, we need to remember that we need to use only 8 number and 10 number hand files. 15 number file is considered a rigid file and can cause ledging, transportation, and etc. So 8 number and 10 number K files or reamers are the instruments to be used for manual glide path preparation. So manual glide path preparation has several benefits. The clinician will have good tactile sense, and also the anatomy of the canal can be recorded. After the manual glide path preparation, if needed, we can go for the Rotary NiTi files for glide path preparation. We have glide path files from several manufacturers. 2 representative files I've put here. So these are generally having a smaller taper like 2%, and they are also having smaller tip size. And Rotary files are also very good for glide path preparation, but we can safely use them after using at least a 10K manual glide path. Also, we need to remember that the manual glide path of a 10K file should be super loose in the canal before we put any rotary instrument in the canal. The next step is pre-curving the file. Pre-curving the file is nothing but adapting the file shape based on the preoperative radiograph. This pre-curved file traverses the curve better than a straight file. So basically, we use 2 types of pre-curving. One is a gentle slope. So whenever we are putting the file in a virgin canal, A gentle slope into the file can be incorporated with the fingers, and this will help in preventing any, like it will help the file to better traverse the curvature. The other type of curve that can be incorporated into a file is a J bend at the tip of the file, which can be incorporated by using a endo bender pliers. Now, using these pliers prevents the flutes from getting deformed or kinked. Now, this type of curvature, this type of pre-curving is generally used when we want to bypass a ledge or canal blockage. Another very important point for managing a curved canal is the extravagant use of smaller number files. So generally we use 8 number or 10 number files. So the 8 number file has to be super loose in the canal before we use a 10 number file. And the 10 number file has to be super loose in the canal before we use any sort of rotary system into the canal. Also, these small files must be used for recapitulation between instrument changes. The next is the use of intermediate size of files. Now, when all of us know the diameter of the files. So the 10 number file has a diameter of 0.1, whereas the 15 number will be almost 50% increase in size. So this will be a too large diameter for the subsequent file. So using a file which is in between number between 10 and 15 like 12 will help in reducing the stresses on the file, especially in a curved canal, and help in better negotiation. So we have a number of NiTi files in the market. The doubt or the thing in every clinician's mind will be which system to use. Now, I cannot give a straightforward answer for this, and any system can be used if used in the right context and for the right canal. So I will give you a few points regarding the NiTi files, which will help you in choosing the file system yourself. So a very brief thing about the metallurgy we have to understand in making a proper selection of the NiTi file system. So basically nickel titanium is made up of 55% nickel and 45% titanium, which gives an equiatomic ratio. Now, why is nickel titanium so popular or so much better than stainless steel? It is because this nickel titanium has a phase transformation between two phases, which are austenite phase and martensite phase. Now, the austenite phase is what we refer to as the parent phase, and it exists at room temperatures or higher temperatures. So initially when nickel titanium was introduced into the market, it was all the files were in this austenite phase. Now there is another phase of nickel titanium called the martensite phase, which is also referred to as the daughter phase, or this martensite phase exists at a lower temperature. Now the beauty is that these two phases are interchangeable either by temperature or by stress. So because of this unique phase transformation, we have two important properties of nickel titanium, which are super elasticity and shape memory. So all of us know what is elasticity. We have all used a rubber band. When we stretch the rubber band and release the pressure, it comes back to its original dimension. That is elasticity. So metals exhibit something called the Hooke's law. They follow the Hooke's law, that is stress is proportional to strain. But this nickel titanium is an exotic alloy. Instead of following the Hooke's law, it can take up a lot more stress before it actually undergoes deformation or failure. That is, it is not elastic, it is super elastic because it takes a lot more stress than a normal alloy. Again, this also happens because of its phase transformation property. It shifts from austenite to martensite, and in the martensite phase, it takes up this stresses. The other important property, which is shape memory. So shape memory is a phenomenon which is dependent on temperature. So when you have a shape of the alloy and this is at a lower temperature and you deform it, After deformation, again when you heat it, it recovers to its original shape. This is the phenomenon of shape memory. Using these two properties, we have a number of systems of NiTi in the market. So for the management of curved canals, the thing that we fear most is the fracture of the file. So let us understand how a file fractures. There are two mechanisms, the first being cyclic fitting. Now, when we are using a nickel titanium file in a curved canal, it undergoes repeated cycles of compression and tension. And with repeated number of uses, it has a certain limit and it fractures. That is, whenever a file fractures after repeated uses, it is because of cyclic fatigue. The other reason a file can fracture is because of torsional fatigue. By torsional fatigue, even a new file can fracture. This happens when the tip of the file gets locked within the canal and the shaft continues to rotate. This causes stresses on the file and the file fractures. If we understand these two mechanisms, we can prevent a lot of file fracture in our cases. So briefly, to understand the evolution of the NiTi, in the initial years when NiTi was introduced, it was in the austenite phase. So austenite has super elastic property, or it has a spring back property. And the initial conventional NiTi was totally in the austenite phase. Then came some thermal treatments, which is referred to as the M-wire. Now, the M-wire is also predominantly austenite and contains certain amount of martensite at room temperature. Hence, this technology also, the files have much more fatigue resistance than your conventional files. The main aim of doing all these treatments was to increase the fracture resistance of the file systems. Then came the control memory and the other systems. From here onwards, the files are predominantly in the martensite phase. So when a file is in the martensite phase at room temperature, it exhibits much more fracture resistance, and it is also very soft and it does not have the spring back. So you can pre-curve these files. So let us briefly look at some of the file systems with the different technologies. The M-wire technology is used in ProTaper instruments, ProTaper Next, ProTaper Ultimate, etc. And as I mentioned, compared to the conventional NiTi systems, M-wire has a superior cyclic fatigue resistance. Next comes the R phase. Now this R phase is an intermediate phase between the austenite and the martensite. So the basic reason why the files were made as twisted files is, now generally the files, nickel titanium files, are manufactured by machining. So this machining introduces some surface defects in the file, and these act as sites of crack propagation, eventually resulting in fracture of the file. So to have a and avoid all these cracks in the surface of the file, the twisted files were created by a manufacturing process of twisting. This could happen by getting the files into the R phase and then twisting. So these files have superior fracture resistance and can be used in a curved canal, the twisted files and twisted file adapter. Now there is one more system here in the R phase, which is not very popular because of its not so great cutting efficiency. Next comes the control memory wire. Again, this control memory wire has great amount of flexibility because it is completely in the martensite phase at room temperature. And also, as I mentioned, it does not have super elasticity. Super elasticity is nothing but the spring back of the file. So this file can be pre-curved and used in curved canals. And its shape is restored after heating. Then comes this gold and blue treatment files, which have increased surface hardness, and the gold and blue color is because of this surface treatment, which increases its fracture resistance as well. There are many more files in the market. These are few of the recent systems with different proprietary heat treatments. In the management of curved canals, high-flex EDM has proved to be quite good according to many of the studies, having a great superior fracture resistance. Now, these high-flex EDM files are also in the martensite phase at room temperature. We have like high-flex CM and EDM, both from the same manufacturer, and EDM stands for the machining process, which is electrical discharge machining. Now, this innovative manufacturing process uses spark erosion so that the file is hardened, and it results in superior fracture resistance and improved cutting efficiency. It has been shown to have up to 700% more resistance to cyclic fatigue compared to traditional NiTi files. So, because of its soft nature and it also allows pre-curving, it better follows the canal anatomy and hence reduces the risk of ledging, transportation, and perforations. So this is the normal sequence that we can use for a moderately or severely curved canals. First, we do the coronal flaring with the orifice opener. Then we use a glide path file, and afterwards we can do the shaping with either a 24% or a 25% high flex files. And as we said, after using, we can, when we subject it to autoclave, they regain their original shape. Even the manufacturer says we can use it for a few cases. It is not a single use file. You can use it for 3 to 4 cases based on the complexity of the case. The next step or the most important step will be proper irrigation, lubrication, and recapitulation. Irrigation plays a very important role. Whenever we are using any NiTi file in the canal has irrigant in the canal. You can never use a file in a dry canal, whether it is a hand file or a rotary file. The canal needs to be wet. Always remember this. And recapitulation is one very important step. Before we go to the next file or the larger file in the sequence, we need to go back to the smaller file and recapitulate the canal and see that the apical patency is maintained, and then proceed. Let us discuss the management of these 3 types of curves which we commonly encounter. Now, an apical curve is also referred to as a J curve because you have a straight portion of the canal and then the apical portion has a curve. So here the management will be, first you can divide the management basically into 2 parts. First, managing the straight portion or enlarging the straight portion in a crown down manner, and then preparing the apical portion of the canal. So here you can start with a proper access cavity preparation, a glide path, and then you can do a crown down up to the point of the curvature. Then you can do again a super glide path. By super glide path, we mean using 2% rotaries and doing the glide path preparation up to 15, 20, and 25 size. So now that we have done a super glide path, we can again follow that with a crown down fashion with using 4% tapered files from 30, 25, 15, and complete the preparation. The master apical file can be a size of 20 or 25 4% taper. So in any curved canals, it is better to avoid the 6% taper instruments. The next type of curvature are called as banana curves, or basically when you look at them, they look like C-shaped from the orifice to the apical foramen. They look like a C. So here the strategy is to again first do the coronal portion and then do this from the curvature to the apical portion. So here again, after the glide path preparation, we are doing a crown down. So when we are doing a crown down, Here we can do one thing is we have to do something called as anti-curvature filing, or try to prepare the outer wall of the canal more than the inner part, because this part is towards the furcation area. And when we convert by doing this, we convert this C-shaped canal again into sort of a J-shaped. And then we can continue the preparation like what we have done previously by doing a super glide path again, that is using the rotaries 15, 20, 25 to create a glide path, and again doing the crown down using 4% instruments. The next is S-shaped curvatures. These are usually found in upper molars. Here also we need to create the straight wave first up to the point of first curvature. Then same thing we can follow is again doing a super glide path to the working length. Here again for the super glide path we are using 2% rotary NiTi instruments in a crown up fashion, that is 15, 20 and 25. Here again using this 2% rotaries, because it is S-shaped and we have to negotiate two curvatures, we do a crown down again with the 2% tapers and then do the crown down with the 4% tapers. So apart from all the things that we have discussed, it is important that we follow the manufacturer's instructions regarding speed and torque of the instrument, and preclinical training is a must before we use the rotary systems in the patient. This will give us an understanding of the problems that we face and which we can learn before we actually do a patient. Other important things are never ever force a file. All of you, when you do a root canal, whenever you feel a resistance, we have a lot of temptation to apply a little more pressure, and that little more pressure is what causes fracture of the file or some defect. So examine for distortion. Another thing, whenever we remove a file from the canal, observe it carefully for any distortion. This is especially for your hand files when you're using the 8 number and 10 number files. The one more point is these 8 number files and 10 number files are single use files. Once you use a file in the canal, don't ever put it back in the canal again. You just have to discard it. Then examine for debris accumulation on the file. So I would like to stress a few things for the management of curved canals. As I just mentioned that number 8 and 10 files are single use files. Number 15K file is not a flexible file. It is a rigid file. It has sufficient strength that it can cause ledging of the canal. Extravagant use of small files, that is 8 and 10, is very, very important for management of a curved canal. Then a super loose glide path. That is, your glide path has to be at least the size of a super loose 10K file. Recapitulation and irrigation are other important things. So I would say the key takeaways are: analyze the case complexity, strategize your approach to success, selection of the right instruments, and a lot of patience. In the words of Beckham, if you want to achieve anything special in life, you have to work, work, and then work some more. So let's see a small video.
David Beckham, and it's useful. Beckham scores for England.
I would like to conclude by saying, bend it like Beckham. Thank you for your patient hearing.
Thank you so much, ma'am, for the wonderful presentation. You can turn off the screen share. Thank you once again, ma'am, for the wonderful presentation. For the people, just quickly summarizing about ma'am. Ma'am has done her MDS from Government Dental College, Bangalore, and she has completed her LLB from BDS Law College, Bareilly. Also, she has completed a post-graduation or certificate course in health research fundamentals from NPTEL, and she was all India ranked fifth in that course. She is right now vice principal of MNR Dental College and head of Department of Conservative Endodontics. Ma'am has also published a book on biomimetics and restorative dentistry, and she has trained numerous individuals and students in her post graduation for endodontics. Despite her busy schedule and so many commitments, thank you, ma'am, for giving us the time to arrange this wonderful lecture. Thank you so much once again.
It was my pleasure. Thank you.
We have a couple of questions, ma'am, if we can. There is one question from a
Yes.
participant that what are the 2% Rotary files? Which are the 2% Rotary files available in the market?
So we have these glide path files from Dentsply, and most of the companies also give the path files which are of a lesser taper. So even the race has its glide path files. So any files which you are comfortable with, you can use.
Is there anything else that anyone wants to ask, ma'am? If not, we all will wait for a minute. We have a certificate for ma'am here. Any doubts, please feel to drop a message or you can unmute yourself. Yeah, we have one more message. How many times during clinical cases apical transportation occurs? And
Sorry,
how to handle them? Many times during cases apical transportation occurs. How to handle them? From Dr. Saurabh Jain.
So, as I've mentioned you, prevention is better than cure. So, apical transportation can be prevented if we restrict our hand use of files only to 10 number. The moment you are using a 15 number file, there is a chance of causing apical transportation. So, what we can do is use the manual K files or reamers, 8 number and 10 number. And if you still need a glide path larger than that, we can do a rotary glide path instead of continuing to our 15 size K file, because these glide paths are made up of nickel titanium and they will not cause transportation. However, if transportation occurs, there is, I think, little that we can do. Maybe the sealing can be improved. Now we can use sealers like bioceramic sealers, which are more conducive to filling and healing of the apical area.
Thank you, ma'am. I guess Dr. Saurabh, that answers your question. Anyone else with any other doubts? Just a minute.
Can I ask a question?
Yeah, please.
What is the advantage of using rotary files in case of like reciprocating files against the rotary files? Like which one is better for pediatric pulpectomy cases?
So,
Thank you for your question, Doc. Can you introduce yourself first?
What are the major like reciprocating files available in the markets?
see, basically, reciprocation was again introduced to reduce the fracture of the files, because these files, when they are used in reciprocation, they do not complete a circle in one go. So the cyclic fatigue resistance of the file is increased. That is the basic reason that the reciprocating files were used. And many of the reciprocating files are single system files. So it reduces the number of files that we need to use. This was the basic concept. But a lot of clinical studies have shown that reciprocating files, the post-operative pain is slightly on the higher side because of the debris extrusion. The debris extrusion is more with the reciprocating files, and the comfort to the patient also. When you consider the motion, the patient is more comfortable with a rotating motion than with a reciprocating motion. So this is the comparison between rotary and reciprocating files.
I guess, Doc, that answers your question.
Yes, sir. Thank you so much. Thank you so much, ma'am.
We still have 2 more minutes if you want to ask any questions. Which is better to use hand NiTi or rotary files from Dr. Venkatesh Perthuratu?
Hand NiTi or rotary NiTi files?
Yeah.
Okay. See, the hand NiTi files are basically, again, not having such good cutting efficiency. We use the hand files only for the glide path preparation. Yes, you can definitely use them, but for the rest of the preparation, you need to use your rotary files. Otherwise, it's going to take a long, long time.
Absolutely. We have a small token of appreciation from AshKam. Thank you so much, ma'am, for spending your valuable time with us. Thank you so much for the valuable insights that you have shared. I'm sure that we all have understood more about management of curves and how to go about them clinically. I would like to thank you on behalf of the whole team. And most importantly, I would like to thank everyone here for being present at 10 a.m. on a Sunday morning and making the most out of this session.
Thank you. Thank you, one and all.
Thank you, ma'am.
Thank you so much, ma'am, for giving us your time and talking in detail about the 10 successful commandments of managing a curved canal, the complex ones. I hope it's going to be very useful for all of us. And I really like the way you explained about the curved canals in detail, moving step by step, talking about the role of lubrication, how to choose a rotary file, which rotary system is best, talking about metallurgy. Oh, thank you, ma'am. It was a very nice presentation. Thank you so much. And we are looking forward for more such presentations from you, ma'am. And
It would
thank
be
you,
a
Dr.
pleasure.
Sagar.
Yes, thank you. Thank you so much for the opportunity.
Thank you so much, ma'am. Thank you, Dr. Sagar. Thank you for sparing your time and moderating the session. And I know you have been always there with us. For whatever we want, you are always there like a solid rock supporting us in all the, every time. And well, just to mention this event is sponsored by AshKam MedTech Private Limited. So I request all of you to please go to their website, have a look. You can also follow them on Instagram, Facebook, and LinkedIn. And a small token of appreciation from AshKam to you, Dr. Sagar, for sparing your
Thank
time.
you so much.
Thank you so much. Well, the next session is going to be presented by Dr. Jigyasa. She is head of the department in Department of Conservative Dentistry at PGI Rohtak, and it's going to be tentatively on 4th of July, though we are yet to confirm the dates from Madam. So I would like all of you to follow us. Either you can follow us, by going through our website or follow us on Instagram, LinkedIn, or Facebook, wherever. We are going to update the details with you soon. And well, in the end, just I'm going to summarize few of the products. So please have a look. Thank you so much.
Introducing the Rainbow Series Shaper by Perfecto. Efficient shaping, simplified sequences, and ISO color coding. Perfect shaping for routine cases. Smooth, safe, and predictable.